Hi, my name is Rachel Riley, and I am doing my presentation and my research on influenza vaccine hesitancy in parents. To begin, my target population is parents of children ages 6 months to 18 years old, and children at high risk of developing serious flu-related complications if they were to get the seasonal influenza, and it is actually way more dangerous than the common cold in kids. And millions of kids get the flu each year, leading to thousands hospitalized and, unfortunately, in some cases, even death. In 2010, 7,000 to 26,000 hospitalizations of kids under the age of 5. And the flu-related deaths in children, according to the CDC, in a normal flu season range from 37 to 187 deaths. And every year, children have the option of getting an injectable vaccine, which is recommended for 6 months and older, or they could get the nasal spray, which is for ages 2 and up. Reasons to vaccinate your children for seasonal influenza is to overall reduce the cases of the flu each year. And less flu means less doctor's visits for children, and that also means less missed school for them. And also, you want to vaccinate because it'll reduce hospitalizations and deaths. There are many risk factors when it comes to the flu, but the main ones are just overall the complications that could come from it. Pneumonia is a big one, dehydration, sinus issues, and in the unfortunate cases, mortality. And getting the flu shot, really reduces these risk factors of the virus. And then social determinants of the parents. So if they're able to get their children vaccinated, that's actually really related to health services available to them. If they're unemployed, they might not have health insurance, which might be harder for them to get their kids vaccinated. Or their, income is also a big one if they can afford to get to the doctor. Social factors of the families. If they grew up not getting vaccinated themselves, or if they're around family and friends that do not believe in vaccines either, that will really influence their decision, and they may or may not get their child vaccinated based off the social factors in their life. And also demographics plays a big role. There are parts of the United States where vaccine intake is higher than other cases in other states. Demographics plays a big role. So the goal would be to reduce vaccine hesitancy. And the importance of that is because the increased number of children that have gotten their vaccine means overall cases of the influenza will be low, which is the goal. And it'll decrease long-term complications that could come from the flu. And again, just overall less deaths, which is the ultimate goal. And designing interventions is important when targeting these parents, because every parent is different and everyone raises their children in a different way. And in order to develop an intervention, you really have to consider the parents' views, their values, and also the social determinants like we mentioned earlier. You're going to have to design your intervention around whatever the parent may feel about vaccines. And you have to understand why they're vaccine hesitant, because that will lead to a successful intervention if you can really target the concerns that they may have. So understanding vaccine hesitancy, the main theory that I have found personally that helps with understanding is a transserial model of change. The most common reason that parents may be vaccine hesitant is a lot of it is fear. They're actually more worried about the risks of vaccines than the actual disease itself, which causes them to be vaccine hesitant. So using the transserial model of change, you can figure out what stage a parent is on when it comes to vaccinating. If they're, closer to the top stage, they might be, closer to vaccinating, or the bottom, then they might be far. And it's just important to really find that reasoning to figure that out. And some protective factors to consider. Healthcare workers is a really big one. They are the ones that can educate parents and they can target a parent's level of knowledge and depending on the stage. And the 5 stages of the model are pre-contemplation, contemplation, preparation, action, and maintenance. And according to Corbin, he did a lot of research on this, and the research explains that there is an association between direct communication style and the willingness to comply with vaccine schedule for their child. So therefore, motivational interviewing is the best technique that is shown to actually change their behavior and make vaccine uptake more regular. So overall, just figuring out what stage the parent is on can really help understand why they're vaccine hesitant and what kind of interventions to make around that. So addressing influenza vaccine hesitancy with theories, I found 3 of our theories. Perceived fear and threat appeals. That can actually teach parents, you can use that to teach parents the side effects and the dangers of influenza by kind of scaring them into vaccinating, essentially, and kind of just showing them that if their child gets the flu, there is a lot at risk for their child. And hopefully, using this theory, we can change their behavior by showing them that ultimately the virus is worse than the actual vaccine itself. And then the social cognitive theory, it has been used to form interventions to persuade parents to vaccinate as well. There was one finding by Benazarnik, and it's called the P3 model. So it's the practice, provider, and patient model. And it was actually invented with the use of the social cognitive theory. And it addresses the interaction between the patient and the other components of the healthcare system and the environment. So essentially, it takes all those environmental factors of why a parent is vaccine hesitant, and it forms that model to really target, and the purpose is to teach parents why they should vaccinate their children. And understanding their behavior can lead to targeting their vaccine concerns so healthcare workers can provide them with correct information. And in Benazarik's article, the P3 model is used to assess the effectiveness of the prevention promotion efforts and explain why the parent is vaccine hesitant. And then lastly, like I mentioned earlier, the transtheoretical model of change is useful when addressing vaccine hesitancy, because you find out what stage that the parent is on. And with that, you can try to get them to change to the next step and bring them closer to vaccinating their child. So my proposed intervention strategies, I personally felt that perceived fear and threat appeals would be the most useful. You can make an intervention that warns a parent of all the risks of the flu, like in a pediatric office, maybe have pamphlets that have all the risks, and just have the healthcare workers provide the parent with the knowledge that if their child gets the flu, what is essentially at stake. And the constructs with this theory, we want to educate parents on the risk of the flu using a persuasive message to scare them of the complications of their child catching the flu. So you change the behavior with the inspiration of fear appeals, meaning you use fear to ultimately change that behavior. And then the social cognitive theory, you can use this theory to educate parents on the benefits of the vaccine, regardless of their social exposures. And the constructs with this one are goal formation, knowledge, self-efficiency, social structure factors, incentive motivation, and outcome expectations. So with that, healthcare workers can have a goal formation, which would be the goal is to get the parents to vaccinate their children for the flu. Knowledge is a construct because you have to figure out what level of knowledge the parent currently has when it comes to vaccines. You have to figure out their education. Maybe they came from a scientific background, so they understand vaccines a little bit more, or maybe they have no knowledge whatsoever and they just kind of go with everybody else and they're like, oh, I want to be vaccine hesitant. So knowing their current knowledge of vaccines is important when making that intervention. And incentive motivation, again, you want to really give them, when parents care the most about their children. And so giving them motivation to vaccinate their kids, ultimately keeping them safe alone, is a big motivation for parents to vaccine. And the outcome expectations, you just expect to get more parents on board with vaccines and get their child that seasonal influenza vaccine every year. And using these, it can be used to target each parent differently, because every parent is going to have different concerns about vaccines. Not everyone is going to have the same worries that the next parent will have. So when you use that intervention and you form it, using these series is really important, because you have to learn what knowledge they have and what is the next step that you can do to change their behavior. And then there's a lot of ethical concerns that come with vaccine hesitancy. A lot of people are against vaccine research and testing. A lot of people are against, the fact that they go through animal facilities and drugs are tested on that. They believe, it just goes against their moral beliefs. And then access issues. You have to understand that not every parent is going to have the same access to vaccines as the next person. And that is a big factor when, having the flu vaccine available. And then a lot of times parents get frustrated if it's mandated by the government. A lot of parents don't. There's some out there that don't like to be told what to do. And so when governments are requiring them for schools and certain situations like that, parents actually tend to push away from it and want to do their own thing, because they want to ultimately make their own decisions for their child and how their child gets raised. And then you also have to take culture into consideration when you are designing these interventions. When you use those theories, like I mentioned, you have to really understand how the parent feels first, and then use that intervention to change the behavior. And healthcare workers just have to be cautious, because going about it the right way is really important. And a lot of parents might have moral issues against vaccines. Religion is a big role a lot. There's some religions out there that do not accept vaccines. And so that's something that healthcare workers have to be careful of. You have to figure out how to go about that and how to teach them the benefits. And then lastly, their socioeconomic status. Like I mentioned before, that's a big one, because if they, don't have the proper funds to vaccinate their kid, just that access to healthcare is a really big indicator. And you just have to form these interventions based off these things. And it's important if you're really trying to change that behavior. And here is my sources. Thank you so much for listening.